Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
For parents, understanding the importance of HPV vaccine is crucial in making informed decisions about their child's health. Awareness of this vaccine equips parents to take proactive steps in protecting their children's future. The significance lies not only in immediate health benefits, but also in the long-term impact of their child's well-being. Informed parents are better positioned to navigate healthcare choices, ensuring their children receive the best possible protection. This discussion on HPV vaccine will further aid parents in making confident, informed decisions that could have lasting effects on their child's health. Welcome everyone. I'm Dr. Samya Saluja from THIP Media, and today we are delving into the complexities of a crucial topic, HPV vaccines. And to guide us through this important discussion, we are honored to have with us the esteemed gynecologist, Dr. Priyanka Mehta. Dr. Priyanka Mehta is a distinguished integrative gynecologist, fertility care provider, and laparoscopic surgeon based in Dubai, UAE. With a strong commitment to patient education, preventive medicine, and the promotion of holistic health, she is currently practicing at Wellness Clinic, where she specializes in menopause care, bioidentical hormone therapy, fertility care, and hormone balancing. Additionally, Dr. Mehta is affiliated with the Canadian Specialist Hospital, where her surgical expertise extends to procedures such as vaginal birth, cesarean sections, laparoscopic ovarian cystectomy, endometriosis surgery, fibroid surgery, myomectomy, and laparoscopic hysterectomy. Dr. Mehta's extensive experience spans over 2 decades, having served in prestigious hospitals in Delhi and Chennai. Her deep passion lies in caring for women throughout the stages of pregnancy. Ma'am places particular emphasis on pre-pregnancy care and pre-conception counseling, guiding couples as they prepare mentally, physically, and emotionally for the journey of parenthood. Ma'am's holistic approach ensures that the experience of motherhood and parenthood is one of the celebration and joy despite the stresses of mortal life. Dr. Priyanka, THIP Media welcomes you, ma'am.
Thank you so much. It's a pleasure. Thank you for having me. I'm looking forward to this session so that we can, just as they say, sprinkling. There is a lot of information around, so we can just add in to the information about this very important topic on HPV vaccine.
Right. Great, ma'am. And the pleasure is all mine. So thank you for your precious time. So, ma'am, we all understand, that HPV and its related, health risks, they are of significant concern. Yet, many individuals you must have, come across in your practice, they might be feeling apprehensive about receiving the HPV vaccine. So, with this in my mind, I'm going to start this discussion with the most fundamental question that why is the HPV vaccine considered a significant tool in preventing certain types of, let's say, cancers?
So I think we should always remember in medicine, prevention is better than cure.
Right.
HPV vaccine, there are 200 types of HPV vaccine. Some are low risk and high risk. And this is one of the only, HPV vaccine is one of the only vaccine which can prevent a cancer.
Right.
So cervical cancer, in fact, if you look at our subcontinent, it's the second most common cause of death due to cancer, the second most common cancer in women.
Right.
And we really need to understand that if there is a vaccine, HPV, which is not only useful in preventing more than 90% of cancers of the cervix, that is the lower part of the uterus, also anal cancer, vaginal, vulvar, even cancer of the mouth, oral cancers, nasopharyngeal, that's the area behind the nose. So all these cancers can be prevented by the HPV vaccine. So if we have a tool at hand which can prevent cancer, I think it's our duty that as medical professionals, as a digital health awareness team like yours, we spread awareness about HPV vaccine, and it's so important.
Right, ma'am. And like you've just mentioned, that there's a wide range of cancers the HPV vaccine helps us in prevent. So, what are the key benefits of vaccinating against HPV at an early age?
So the HPV vaccine program is not something new. It is from
Okay,
2006 and 2007 that it started. But
right,
like any new program we saw with the COVID vaccine, there is always a resistance. There is fear. There are a lot of myths. People are scared that vaccine can change a lot of things. But now
right,
there have been, over the past more than 20 years, there is enough research and study that, in fact, I will quote a study which was published in the National Cancer Institute, where more than 450,000 girls have been vaccinated in Scotland. And
okay,
they found that between the age of 9 to 14, there were almost zero cases of cervical cancer in the follow-up.
wonderful,
When the vaccine is given between 15 to 16, where to 15 to 26, when you compare the rates of those who are vaccinated, it's 3 by 100,000, whereas the
right,
non-vaccinated, the rate of cancer of cervix is 8 by 100,000. So you can see that this is a significant protection. We
right,
ideally want to start giving the cervical cancer vaccine from the age of 9 years. That is
right,
the school-going children. So it is
right,
both for girls and for boys. CDC is recommending give the vaccine for boys and girls because it is also preventing against penile cancers,
right,
oral cancers, nasopharyngeal, the cancers, and if the virus is there, which can protect vaccine. So we usually start from the age of 9 to 14, the
right.
school-going children, that's a vaccine program. And even
Mm-hmm.
the Indian Association of Pediatrics is also accepting that, yes, and most of the pediatricians are offering this vaccine to the young people
Right.
from the age of 15 to 26 and even up to 45. Now, this vaccine is, we can, after your consultation with your healthcare provider, we need to give at 3 doses and we can take the vaccine even up to the age of 45 years.
Okay, great. And like you just mentioned that it is very good for both the school going kids and even for adults. So can we understand that how does the HPV vaccine work to protect
Yeah.
against the virus and how effective is it?
So, like we all remember, the last virus we are never going to forget in our lifespan is the COVID, right? So, the coronavirus itself had a lot of variants. You had first the COVID-19, then you had the Delta variant, and so on and so forth. So,
Okay,
viruses usually they cannot survive outside. They always need a host, and
right,
viruses can change their shape. And HPV, human papillomavirus, there are more than 200 types. We
right,
categorize them as low risk and high risk. So we have given
right,
them numbers to make life easy for us. The numbers 6 and 11 are the low risk, and these can
right.
cause genital warts. Warts are
Okay,
basically, they are little, ugly looking lesions. People will just come, there's a bump here, there is something which is not feeling okay. So that is a genital wart. And this can
okay,
actually, it's a sexually transmitted virus. At the same time, it can also spread with close contact.
okay,
So that by these vaccines will protect against the warts. At the same time, the numbers 16, 18, 31, 33, these are the high risk HPV viruses. And
okay,
these can, over a period of time, when you get infected, lead on to cervical cancer for women and the other cancer. So when we are giving the vaccine, our body makes antibodies, and then these antibodies will help boost our immune system so that in case you get infected later on with this any of these virus, you're able to get rid or eliminate this virus from your body so that it does not convert into abnormal condition and then lead on to cancer. But the time period is this is a slow virus, so it takes more than 15 years also from the time of infection to developing the cancer. So we have a long latent period, and that's why when you catch the children earlier on at 9 years up to 14, and then even up to 45 years, like you may not have got infected with the virus, it can help protect against the cancers.
right. And now I'm just going to shift the focus to the ones who might not even need the vaccine. There could
Mhm.
be certain contraindications for the HPV vaccine, or there could be a group of people who should avoid it. something in that.
So we definitely during pregnancy we avoid the vaccines unless we are giving those which are specifically needed during pregnancy. But in
Right.
case you have taken the first dose of the HPV vaccine and you get pregnant, it's a killed vaccine, so you don't need to panic about it. That's okay. If you
Right.
have been taking the first dose and you get pregnant, then you can complete the course after you complete your pregnancy. In
Okay.
breastfeeding, we can give this vaccine, no harm. Severely immunocompromised with severe illness, of course, we want to avoid a vaccine. But at the same time, if you have someone who has the retroviral infection, HIV infection, then also we are recommending to take the 3 dose of the HPV, because HPV, human papillomavirus, in a patient with HIV can lead on to a cervical cancer faster. So you can give in those conditions. So only
Okay.
pregnancy, and or if you have allergy. So all these vaccines have a base medium which carry it. So if you
Okay.
have, probably an allergy reaction, or you are someone who's susceptible to allergies, then talk to your healthcare provider and they could do
Right.
the allergy test, and then we could decide if this vaccine is for you or not.
Right. And now, coming on to the safety of vaccines, like, there's been a lot of speculations about the recent one. You've just mentioned about the COVID, so I'm sure HPV might not have been spared. So, how safe is the HPV vaccine, and what are the potential side effects that, particularly parents should be aware of?
Yeah. So I think parents, this is one common question. I recently had someone call me, that my daughter is 13 from school. They have asked that we need to give the cervical cancer vaccine. And then they research about HPV, it's an STD. So my daughter is not sexually active. Why should we take it? There are all kind of questions come in
Yes.
parents' mind.
Yes.
So when
Right.
you talk about HPV, it is uh, of course, you are not worried about a 12 or a 13-year-old, but later in life, your child is going to. So this is just promoting responsible behavior that ways where you are giving the vaccine
Right.
and you're protecting your child against the vaccine. Otherwise, the
Absolutely.
vaccine is absolutely safe. It is not going to affect your fertility or the menstrual cycle, or the maximum effects are maybe some pain and soreness, and even that is fine. So I have two
Okay.
daughters. I made sure that they are vaccinated with the 3 doses. So I think
Right.
that's the key. Leading by example is the key.
Yeah, absolutely. I agree. And I'm sure that you must have come across certain myths and misconceptions about the HPV vaccine, particularly from the apprehensive patients. So, being both a responsible healthcare provider and a mother yourself, uh, how would you say that these issues can be addressed?
So I think we have always in medicine, we are talking about evidence-based medicine. We have randomized control trials. We have studies which have been done. So
Right.
from, like I told you, 20 years, we have a lot of solid data, good evidence that these vaccines are safe and they
Hmm.
have been given. So most common fear with vaccine, I think, is autism. I don't know for what reason there has been a connection, and that's why if you look at India, we don't even think about the vaccines. I think we are all very happy and we have a vaccine card and we very, diligently, religiously go to our doctors and get the vaccine. And we have enough data that this vaccine is absolutely safe. For, like I told you, this study in Scotland also, where they have seen the
Right.
follow-up has been done over a period of 20 years. So that is where, you need to keep busting the myths and keep talking to people about how
Right.
it is not going to cause infertility, it is not going to cause any kind of autism and things like that. So talking to your provider is something which is most important.
So open communication and an open
Yeah.
dialogue, both at home, I suppose, and with the healthcare
Yes.
provider is the key here.
Mm.
Right.
Mhm.
And another thing is health literacy about these vaccines, which I
Yeah.
think should be very proactively followed. So can
Mhm.
healthcare providers effectively raise awareness about HPV vaccines apart from just this open communication?
Yeah. So I think, in my practice, I try to do that because I get a lot of young girls, they are coming
Right.
at different ages.
Right.
Sometimes, even if they are less than 16 years, they come with their mothers for some vaginal discharge or polycystic ovary
Right.
or, something else. So it's not that if they come only for a condition where you think, okay, this could be high risk behavior or, you want to. So all the girls and women, and even sometimes they would have had an abnormal pap smear. Then
Right.
we do a follow-up, we do the testing, say a colposcopy, and then we do the HPV testing, which is again done like a pap smear. And if the results are negative, you offer them that, okay, even if you're 30 or 35, think about the HPV vaccine because we now have a vaccine which is protective against 9 kind of HPVs. When we started, we had a vaccine which was taking care of 2 types of HPV, and now it has become, like 9-valent vaccine. So just giving them the options, talking to them about it, and then most of the girls are able to understand that if this is something which is useful for me, I'm ready to take it.
Okay.
I think
And
cost is a limiting factor, but even the Serum Institute has been working on,
right,
the low dose
cost
vaccine, and
effectiveness of the vaccine.
so
Yeah,
absolutely, yeah. And I
right,
think Mrs. Sudha Murthy also created awareness. It was in the news a couple of months back when she spoke about
right,
the cervical cancer vaccine in the parliament. So we also need a lot of these thought leaders, people
right.
who are in the public space to make some noise about it. And I think once we have a celebrity endorsing it, then it will be taken up even faster.
Absolutely. Right. And you just mentioned that the vaccine is as important for both the genders, let's say both the boys and the girls. So should girls and boys receive the HPV vaccine at the same priority? And what are the advantages of, now I'm going to mention the boys and not the
Yeah.
girls, immunizing boys versus girls?
So it's like, even when we are treating for something for a married couple who is coming in and they have an irritating infection like fungal infection. So you know that they are going to, it's going to spread with close contact, intimate contact. So we always treat the partner too.
Right,
Similarly, I think if we are going to, and even if you see the pregnancy antenatal program, so all antenatal mothers, when they go to the hospital, we test them for the infections like HIV or hepatitis B, hepatitis C also. So this is the way of, trying to reduce the burden of disease by not only testing the ladies, but also finding out if their partners are infected in case someone is infected. So
right,
similarly, when we start the vaccine, and this is a recommendation from CDC, that boys and girls need to be vaccinated from the age of 9 years onwards. And that's what we need to continue, because it's not only the cancer in women, there are also, in fact, I think Michael Douglas, he had a nasopharyngeal cancer, and that was related to the HPV virus, because again, it is related to the sexual behavior too. So
okay,
you do need to think about vaccinating both the boys and the girls, and protection against oral nasopharyngeal, the genital warts, and different other warts also, which are caused by the HPV. And that, once you convey that, then parents, young adults, they understand that okay, this is something which is not going to do them harm, and it's going to be beneficial. Yeah.
okay. And most of the times, these young kids, they are at school. So I think, the teaching professionals and the ones who are usually in their institutions, they can play a very strong role. So how can
Yeah.
schools and educational institutions contribute to promoting HPV vaccination among students?
Yeah. So I mean, school is where they spend more than 6 to 8 hours. And
Right,
often, I remember 2 or 3 years back when there was a scare of the measles in the
right,
US. Again, we had a vaccination drive in the schools, because that is where we have accounted for all the children. They will be coming there. So it's easy to, inform them and give information through the children to the parents. Sometimes it's very
right,
easy to reach the entire population if you do these things in school. I think even during the COVID time also, right, we use schools as vaccination camp area. So when we pass on the information about the HPV vaccine, which is absolutely safe at the school level, and maybe organize some kind of camps there or organize the vaccination there. We used to have it in universities also, where we have a vaccination for the college students. So this can move to the schools, and I'm sure it will be, we will be able to reach out to the population in a better way.
right. And I think a lot of peer support would be there, and they're almost of the same age, and they'll be able to understand and grasp the
Yes.
significance better. Right.
Yeah.
Okay. And I'm just going to summarize this entire session that you've just so beautifully answered by reinforcing certain things about the parents and teenagers. So, how can parents and these young adults or teenagers make informed decisions about HPV vaccination?
Yeah. So I think through portals like yours, whereby we have a practicing clinician who's been practicing for more than 20, 25 years. And we have seen over the last 20 years how this vaccine has evolved. Because even in 2006, I remember initially there is always skepticism. People think, okay, I should not take it. And now The IAP has also taken, I mean, the pediatricians always, when we go for my daughters also, whenever I went for their checkup, I was informed.
Right.
And that's how all the myths will, that will go away. And I think all of these medium is important. And we present to them that these are the guidelines by the WHO, by the CDC. This is being followed in the US. This is being followed in the UK. This is part of the vaccination. Also, I think important is that people should not become complacent, that if they have taken the HPV vaccine, they don't need to do the pap smear. So
Yeah.
pap smear and HPV, they go hand in hand. They're
Right.
complementary. And by taking the HPV vaccine, you may protect yourself against 90 to 95% of cervical cancer. And even those with, but you need to, there are still a percentage of cancer which are non-HPV. So you need to keep doing the pap smear. And often we offer for women both the pap smear and the HPV testing also at the same time, so that we can reduce the burden of the disease. And
Right.
I think just keep on talking, communicating, sharing more information, news, and that's how we can reach out.
Okay. So on that wonderful note of open communication and prevention, I suppose, is important,
Yeah.
but is not the alternative, for the routine screenings that you usually perform in the clinic. Is a very simple message by Dr. Priyanka Mehta. So on that wonderful note, ma'am, thank you so much for joining us today. It's really, really been a pleasure. And I'm hoping that the enlightening information shared would be, valuable to many families out there. So thank you so much for joining us.
Thank you. It was a pleasure. Thank you so much from your health tech company for doing this amazing work. I think tech is something we can tech AI. I think we can just, we are there where we can, prevention is cure, and we can reach out to so many people sitting in their homes with their mobile phone. And I hope that this message spreads far and wide. And I'll be happy to answer any questions which arise after that. We can really have another session, maybe if there are questions which come out of this, to address those.
Absolutely, ma'am. And for more such informative videos, please do subscribe to our channel and press the bell icon for regular updates. Thank you once again. Thank you.
Thank you. Bye-bye. Thank you so much.